We frequently see a number of young athletes, and one of the most common things we see they're usually overuse injuries. So kids that are practicing too frequently, especially in youth baseball, kids that are being pushed too hard, that are throwing too many pitches, throwing too many curveballs, things like this. And typically these overuse injuries are very easily prevented. USA Baseball has actually come out with some guidelines for youth sports, especially baseball, that limit the number of pitches, give recommendations for types of pitches, and even the number of pitches per week. Another way that this can be prevented is through technique. Proper technique and proper coaching is essential to avoid injury. I don't think there's much correlation between how many sports a child plays in regards to what and how frequently their injuries are. I think it's mostly related to adequate warm-up, adequate technique, and limiting the activity when needed. A lot of times we get asked, when should we sit out, when should we stop? A lot of coaches and parents and a lot of kids themselves like to really push themselves through a lot of pain. I think everyone's pretty aware when you have a common bump or a bruise, and you have a pretty good idea most of the time if something further is wrong. What we normally recommend is give it a couple days, some ice, some rest. If you're still having pain, it doesn't feel like it's getting better, you should definitely come in and see somebody.